Clinical features of the Pagets disease. So here are the signs and symptoms. It includes that the majority patients, they are asymptomatic. Looking at the skull, there is deformity. This is with the enlargement, hearing loss, as well as presence of dizziness. This is with respect to the skull. Next, looking at the spine and the pelvis, there is bone pain, spinal stenosis, and the nerve compression. Now looking at the long bones, there is the bowing deformity, and this is with increased fracture risk. Now looking at the bone tumor, it results in the osteosarcoma and the GCT. This is nothing but the giant cell tumor. This is usually benign. Now looking at the lab findings, there is elevated serum and the bone specific, this is the ALP. And looking at the bone markers, it may be elevated or may not be elevated with active disease. So this can include PNP, PNIP, CTX, NTX, and the urinary hydroxyproline. Now next, looking at the other findings. In case of calcium and phosphorus, they are usually normal, and it may be elevated with the fracture and immobilization. Next, there is also the plain radiographs. These shows the osteolytic and the mixed lytic or the sclerotic lesions. Now next, looking at the diagnosis, this includes the combination of the radiograph findings and increased ALP. Other thing to note is there is no additional bone turnover test or imaging required for the diagnosis. The bone scan is more sensitive, greater than the X-ray, and it is helpful to know the extent as well as the location of the skeletal involvement. Treatment of Pagets disease includes the biphosphonates, and they are